State your name,
Jenny Casey,
today's date.
August 22nd, 2016.
And Jenny, what are you diagnosed with?
I have complex regional pain syndrome.
And how did you develop this?
The symptoms showed up after I got bitten twice on my left hand by some dogs. One was a puncture wound in between my thumb and index finger, I guess, and then an abrasion on the left side of my left hand. And then the symptoms showed up after that, and I've had it for almost 4 years.
So how soon after your symptoms were you diagnosed?
Not officially for about 9 months. There was, at first I was diagnosed with lymphedema, which I later found out that's just a symptom. It's not. And then doctors were tossing out other ideas and testing all the way up until July, so of the following year, before they definitively said that's what I had.
So when did this initially occur?
It occurred near the end of October 2012, and I was diagnosed in July 2013.
Okay. And do you state where you are?
I'm in Dixon, Tennessee.
At what location?
At the Hampton Inn.
Okay. And you are here for?
I'm here for manual ligament therapy through the GOLD program.
And do you give the GOLD program consent to treat you?
Yes.
Okay. And have you had any surgeries?
No, I have not had surgery.
What type of treatment are you currently doing or have you done?
Do you mean surgery in regard to this or any other surgery?
Have you had any surgery regarding your initial injury?
No.
Have you had any surgery regarding your RSD, CRPS
No.
diagnosis?
Mm-mm.
What type of treatments are you currently doing?
Currently, I'm trying to do this holistically, so I try to control it with my stress levels and exercise and diet and vitamins and sometimes herbal stuff, and just had to kind of overhaul my life and my job and my schedule and my activities and everything. So,
What have been your prior treatments?
and Epsom salt, I use that too.
Does Epsom salt seem to help any?
Yeah, it seems to help.
So what treatments have you done prior to?
During the diagnosis, I was given lots of different treatments because at first they really didn't know what was wrong with me. So I was given compression gloves. I was given epidural, I think steroids. I think I was given stellate ganglion blocks, several of those in the neck. Other treatments. I'm sorry, I'm kind of foggy. I'd probably have to think. Oh, yeah, I had manual lymph drainage, which was normally most of their patients are breast cancer patients who have faulty lymph nodes from surgery, but arm is all swollen and hand is swollen. So I had a lot of that done. Trying to remember what else.
Have you had any physical therapy?
My whole body. I've had some massage therapy. I had some chiropractic therapy. I had acupuncture. I mean, they were just throwing everything at the wall to see what would stick.
Did anything seem to work at all?
I think the manual lymph drainage helped because it was done early, but at the time they didn't know I had CRPS. They just knew my arm was swollen and my hand was swollen. They didn't know why. And I think that helped. I had my hand bandaged for months in gauze to keep the fluid out. Let's see.
But
And
after
also
every
prescription
treatment?
drugs, I was given those too. So, and those, by December of 2013, I had been given a lot of different prescriptions, and I just quit cold turkey. I was having too many other problems, and I knew that wasn't for me. I didn't want any more prescription drugs.
Right.
Period.
Are you on any prescription drugs currently?
No, not for CRPS. I have one other medication I take for something else.
Okay.
But
And how well do you sleep?
I sleep pretty well at night, usually, most of the time.
Mhm. And on a pain scale from 1 to 10 today, how's your pain?
It's a little bit below half, I think. It's not terrible. Um, I have an achy body, but it I started out with really just a very swollen hand and arm, ridiculously swollen, where I couldn't even function with it. I couldn't. It was, stiff and swollen, and then that gradually turned into pain in my arm, and then gradually over time the pain has spread now, and throughout having it, I get pains all over my body in random places at random times for no reason. I can be driving and all of a sudden my right leg, my foot is killing me, or my knee, or I've had things that make me lurch, or I've had to pull over, feeling stabbed, crushed, all kinds of crazy sensations. But now, almost on a regular basis, my body aches and the pain level goes up and down constantly. I try to fight it. This sounds crazy, but I try to fight it by walking, because I don't know what it does, but to move seems to help. So if I start feeling bad, I'm like, I gotta go walk. I have to, or else I'm gonna go crazy. But sometimes it hurts too bad to walk and get up.
So it's a day-by-day case.
Every day's different, but yeah, pain is never gone. It just increases and decreases constantly. But the full body aches are getting more consistent. I would say they're getting to the point where a lot of days I just feel, the best way to describe a full body ache is like I've been beat up, like I've been in a fight and I've been beat up everywhere, or like I worked out too hard and every muscle in my body hurts, and I feel like I've been, rolled off a cliff. So just an exhausting feeling of, and then of course my hand is chronically swollen, and it fluctuates as well. I mean, it can fluctuate in a day from looks really pretty good to it looks like a balloon, and it just depends on what time of day it is.
Do you notice anything, the climate changes, does it affect it?
Yes. Yeah, I think cold has an effect. Sometimes I think maybe barometric pressure has an effect. Altitude changes have an effect. Travel, like vibration, just anything that, I don't know, anything that is not a non-calming environment. I even, for sleep, that's another thing I didn't mention, is I guess it's somewhat of a therapy. I use noise to sleep, a white noise to sort of, I guess,
wind down,
make me zone out. Yeah. Yep.
Do you notice food has an effect?
Yep, definitely. I've tried to stay away from things that are inflammatory. So I try to stay away from, I don't know, excess sugar, caffeine, I don't know, gluten, anything that might be inflammatory. That doesn't mean I don't have any, it's just that I have very minimal amounts. And I try to increase things that help with inflammation, like, I don't know, different spices like peppers and cinnamon and things that are supposed to be good for that. So that's one way with diet that I try to help,
Right. So control the pain.
Yeah, try to do what I can.
So how do you feel right now? How do you feel this morning? Are you mediocre? Are you feeling...
I feel pretty good this morning. Yeah, the weather was nice today. It was sunny. We've been busy this morning, but I don't feel terrible. My arm is achy, I had some sharp pains just a minute ago. My left foot really hurt, for no reason. I'm just sitting here in this chair.
And it's a sharp, like a shooting pain?
Yeah. And I don't make an announcement when it happens, and sometimes, it's frustrating because people don't know that you just sort of are trying to tough it out. And, you don't want to announce every time you're feeling better. You'd be doing that all day and driving everybody crazy, including yourself. So you
Exactly.
just kind of, you know, I've had 4 kids. I've had 2 natural childbirths. I can handle a pain, you know, for for a little while.
Mhm.
Sometimes it gets the best of me, but most of the time I can mentally just sort of, okay, I'm going to get through that.
So you're fairly pain tolerant, naturally.
I think maybe more so than I used to be. So
Absolutely.
I've had to learn to be, yeah.
So what are you hoping to gain from the GOLD program this week?
Remission! Yay! That would be the goal of the GOLD
Absolutely.
program. But yeah, if these crazy pains that are constant, and you know, I have to gently, I don't know, handle my hand and arm. You know, I can't do what I used to do. I'm left-handed, so I've had to basically modify my activities, and you know, sometimes I'm completely, you know, down for the count. I can't do things with my kids or with my family because I just can't. And that's not my personality. I like to do things. I like to stay busy, and that keeps me happy and fulfilled. But to just be this age and to be compromised has been very hard.
And how old are you, Jenny?
44. So I've had this since I was 40.
So 4 years.
Yeah, and I've always tried to be health conscious and take good care of myself. So I feel like it's not a self-inflicted wound, and it seems unfair, you know. And it isn't for anybody, of course. Naturally, I'm not trying to insinuate that someone has brought it upon themselves, but when you're active and have a lot of energy and you're used to, you know, juggling 100 things at a time, and
playing guitar.
then going from playing it. Yeah, I used to. So I taught